Probably get going now. I'm absolutely delighted to welcome you all to the launch of the Healthy Ireland Survey 2025, which is actually also marks the 10th year. The first survey was published in 2015, so momentous occasion here for us all. Just to introduce myself, I'm Fiona Manzer and I work on the Healthy Ireland research side here in the Department of Health. Absolutely brilliant to see everyone who's been able to make it here in person. You're all very welcome. And also to note that this is a hybrid event. It's also going out on our YouTube channel and so on. So this does mean that the event is being recorded, so just to make sure that everyone's aware of that. Before we start today, just a few housekeeping items. The fire exits are there and in through the doors that you came in via. We're hoping that won't be necessary, but should the fire alarm go off, we typically have to trek across to the nearest corner of Merrion Square. That's the assembly point, so just in case that happens, there you go. Teas, coffees and snacks are available over there, including gluten-free. Please feel free to help yourself. And just to note the format for today's event, so we will have speeches from our Minister for State for Public Health, Wellbeing and the National Drugs Strategy, and that's a pre-recorded speech. Then we'll have a speech from our Chief Medical Officer, and finally our partners in Ipsos BNA will present the main findings. And we'll then move on to a Q&A. Now, we're changing the format slightly this year. You'll notice that there's a funky QR code in the corner of the screen. So if you scan those, that will bring you to Mentimeter, and you can submit any questions you want at any time as they occur to you. And we'll queue them up, and we'll try and answer as many of them as possible in the time that we have for the Q&A. If there are any that we don't get to, those can be resubmitted by email either to healthyireland@health.gov.ie or to the press office at health.gov.ie, depending on whether you're a media or researcher or so on. And we'll pop those emails up on the screen towards the end as well. So just to say, it's been absolutely brilliant to have 10 years of the survey, particularly coinciding with the renewal of our Healthy Ireland framework. Supporting our health and wellbeing has never been more important. Quitting smoking, drinking less, exercising more, eating healthily. With reference to this year's survey, getting enough sleep. And our work in Healthy Ireland is providing information as to how to make those positive changes and to protect our health, and the survey is a vital part of that. But it also plays a key role in monitoring other areas of our health services, such as GP, dental, allied healthcare professional, hospital utilisation. This year's survey is taking an in-depth look at contraception and at menopause. We've run period dignity in previous years, and we're supporting the Women's Health Task Force and lots of other areas of work. So without further ado, I'm very pleased to introduce a pre-recorded introduction from our Minister of State for Public Health, Wellbeing and the National Drug Strategy, Jennifer Murnane O'Connor, TD.
Good morning, everyone, and welcome to the launch of our latest Healthy Ireland survey. These data help us to identify trends in population behaviours and in response to develop policies that support us all to enjoy better health and well-being. Every year, the survey illustrates how Healthy Ireland and other departmental policy initiatives are having a positive effect, but also where additional steps may be needed. For example, smoking rates have remained broadly unchanged since 2019 at approximately 17%. We want to get this figure to zero, so we are continually developing initiatives that support people to quit and indeed to prevent them starting at all. These include raising the minimum legal sale of tobacco products to 21 years from February 2028, and making us the first EU member state to do so. We have banned the sale of e-cigarettes or vapes to under 18s, and we have recently banned the sale of tobacco and e-cigarettes from vending machines, and we will introduce new retail licensing measures from next February. We're also investing in a range of supports for both prevention and for quitting. Funding for the HSE's QUIT programme is increasing to almost 3 million in 2025, and we have doubled the number of stop smoking clinics in recent years and have recruited 48 new stop smoking advisors since 2022. The Sláinte Care Healthy Communities programme, which includes supports for quitting and other healthy living initiatives, have been expanded to 24 areas in 2025. There are now record numbers of people accessing our quit services and accessing free nicotine replacement therapy. We're also supporting vaping prevention campaigns for young people. Looking at alcohol figures, it's heartening to see a drop in the number of people who have consumed alcohol in the previous 12 months. However, more than 1/4 of the population are still reporting binge drinking, and 1 in 5 are at risk of hazardous drinking. It is essential that we continue to reduce the harm that alcohol and drugs can cause in our society. We're making good progress by regulating, advertising, sponsorship, retail displays of alcohol and other alcohol promotions, as well as introducing minimum unit pricing. You will hear the full survey results shortly, so I'd like to finish up by thanking everyone involved in delivering it. We're very grateful to our partners in Ipsos B&A for delivering the survey, and to our colleagues in the Department of Health and in the advisory group for managing and overseeing it. I also want to thank the HSC and colleagues across government and other state agencies who have, over the years, contributed questions and modules for the survey or participated in its oversight. But most importantly, I thank everyone who took part in the survey, making it such a valuable resource. Learning about factors affecting our population is what helps us to develop the policies and services that will support us all to live healthier lives. Thank you all.
So many thanks to the Minister for that welcoming speech. So with many thanks, I'd now like to introduce our Chief Medical Officer, Professor Mary Horgan.
Thank you, Fiona. A very warm welcome to everyone today on a nice, so far, dry Friday. I'm delighted to be here today to launch the 2025 Healthy Ireland Survey. More than 7,500 people across the island, across Ireland, participated, giving us really very comprehensive insights into the current state of our population's health and indeed their access to healthcare services. This information provides a very valuable picture highlighting what is working well, but also where additional work needs to take place. And I think the fact that we have data for 10 years is really helpful, because when it comes to public health policy and interventions, it really is a long game, not something that you see an introduction today having an effect in 6 or 12 months. So I think these yearly surveys are absolutely essential in informing us on the path forward. Kieran will go through the results in detail shortly, but I'd like to touch on a few key points and the policies and initiatives shaping them. In 2025, I'm happy to report that 82% of us report good or very good health, showing a slight increase over the past 2 years. And it's worth noting that our life expectancy now is nearly 83 years, so about 84.5 for women and 81 for men, and it's the 7th highest in Europe. Fewer older adults in Ireland report bad or very bad health, and fewer have chronic diseases compared to the EU average. We've also seen the proportion of over 75s reporting good or very good health increasing by 9 percentage points since 2015, which is incredible. That's an encouraging figure given our growing and our ageing population. We've also seen increases in health service utilisation. 4 out of 5 people will have reported seeing a GP in the past 12 months, and on average, an individual will visit a GP about 4 times a year at the age of 15 or older. Given that our population has increased in size by about 800,000 since 2015, it is clear that we are enabling more people to see their local GPs when they need to. We're also seeing increasing numbers of GPs, and just to note, there's about 1,200 GPs in training in Ireland at the moment, which is nearly a doubling of numbers in recent years. There's an expansion of the chronic disease management programme. This is really key, where GPs provide chronic disease management in the community near where the patient lives, and is very happy to access a lot of the local services. Plans are well advanced for a common condition service, which will be accessible through local community pharmacies, where an individual with a common condition can seek care and treatment in their local pharmacies. Moreover, eligibility for free GP visit cards was expanded in 2023, removing cost barriers to GP access for a large group of people. The government continues to expand and support access to oral health care services across the life course through the implementation of the National Oral Health Policy, SMILE Agus Láinte. I welcome the results showing that Ireland's dental attendance patterns align and in many cases exceed those of other European countries, with 39% of the population attending a dentist annually. This builds on findings from the survey in 2020, which showed that 40% of children aged under 18 visited a dentist in the last year. All of these measures are examples of key preventative measures designed to improve access to primary health care for our growing population, based on need and not on the ability to pay, in line with the principles of Sláinte Care. They also help to bring us closer to our goal of providing timely, quality treatment for all, as close to home as possible. This year's survey included a module on carers, representing that key 14% of the population who provide regular, unpaid personal help to a friend or family member with a long-term health problem or disability or illness. And most of us in this room will know somebody who is a carer, or indeed have been or are carers themselves. And we certainly recognise the invaluable role of the family carers play in supporting their loved ones to live with dignity and independence in homes and communities of their own choice for as long as possible. And just to acknowledge the work of carers on behalf of myself and the department. To support family carers, the programme for government commits to improving access to training and respite and fully funding the carers guarantee, helping to ensure equitable access to carer support no matter where in Ireland you live. For the first time, the survey includes a module focusing on women's experience with menopause and related symptoms. New supports for menopause have been driven by our Women's Health Task Force and by the 2 Women's Health Action Plans. It is vital that we talk about perimenopause and menopause in terms of women's lived experience. It's a normal part of our lives, and we should be able to speak about it openly and support those that are going through it. We are now providing wide-ranging supports to women experiencing menopause symptoms. These include 6 public menopause clinics, and since June this year, the provision of free hormone replacement therapy. The survey results show that of women accessing HRT for symptom relief, 93% view it as either very or somewhat effective. Supports also include information campaigns, the workplace framework and training courses and resources for GPs, to raise awareness of menopause and the debilitating symptoms that often accompany them. Another women's health initiative is the free contraception scheme. The free contraception scheme is an example of the progress in the area of women's health and is open to women and girls aged between 17 and 35. With the programme for government committed to further expansion within the lifetime of this government. The demand for this scheme is reflected in the survey, with more than 1/3 of respondents currently using a form of contraception or family planning, raising to almost 3 in 5 of those aged between 18 and 34. Approximately 204,000 people have accessed this scheme through primary care in 2024, with 86% of women aged between 18 and 24 being aware of it, and half of the women in this cohort accessing it. Minister Murnane O'Connor spoke earlier about smoking, vaping and alcohol use. Many of these figures are encouraging and we're going in the right direction. I am, however, concerned about the use of e-cigarettes as it's still at 8%, and vaping remains very popular among young people in particular. Ireland has had a long track record as being a world leader in tackling the use of tobacco products, and we have taken significant strides in recent years. Let us continue this momentum as we aim towards a tobacco-free Ireland. The areas I've touched on here are just a few highlights of a very comprehensive report. I wish to thank sincerely our colleagues in Ipsos BNA for all of their hard work in conducting the survey on our behalf, and also my colleagues in the department. I would like to thank the advisory group and everyone across the department and HSE who contribute questions for the survey, reviewed the result and helped to build the comprehensive 10-year data set that we have today. Finally, a word of thanks to the many people who agreed to be interviewed for the survey. Without them, this would not be possible. Kieran O'Leary will now present a more detailed analysis of the findings, and I would urge you all to take a copy of the report or access the results online and spend time looking at the wealth of information kindly provided by our survey participants. Thank you very much.
Okay, good morning everyone. It's a privilege to again to present the findings from the latest wave of the Healthy Ireland survey for 2025. It's the 10th year that I've stood up presenting these findings. And what we can see from this latest wave, when we look back quite a bit over the past 10 waves, it gives us a very much an up-to-date picture of where we're at with Ireland's health and health behaviours, and crucially, I suppose, a decade-long view of how far we've come and where we must go next, particularly over the past decade when so much has changed, and that's very much reflected in the data that we've collected. This year's survey was conducted by ourselves, Ipsos BNA, between last November and April of this year, consistent with all previous waves in terms of that time period. It's a nationally representative sample of about 7,500 people aged 15 and plus, and it remains a cornerstone of the Healthy Ireland framework and outcomes framework. And the objective of the survey, I guess, is to provide robust evidence to inform policy, to inform service design, and also, crucially, public engagement. The story that I think I'm going to tell today hopefully reflects progress, steady, sustained progress, particularly on some of those behaviours that cause us the greatest harm. Smoking prevalence is down since 2015. Harmful and frequent alcohol use is also down compared with a decade ago. At the same time, as we do each year, this year broadens the lens on health across the life course. We've new depth on menopause, contraception, and the lived realities of caring, areas where good policy and accessible services can and are easing real burdens and improving quality of life. Starting firstly with a view of overall health. In 2025, 82% of people report their health as good or very good. Slightly higher than last year, but still below the 2019 pre-pandemic high. A re-evaluation of our health perspectives, perhaps. Gender differences are minimal overall, but age differences are more pronounced. As expected, younger adults report the highest levels of good health, and those aged 75 and older, the lowest. However, that said, it's worth noting the positive shift among older adults over the decade. Good and very good health amongst those aged 75 plus has risen 9 points since 2015. Very much a key consideration in our continued ageing society. Smoking. The long-run trend very much continues in the right direction. In 2015, 23% of the population smoked. Today, it's 17%. 13% doing so daily, 4% doing so occasionally. That, of course, is meaningful progress at population level. But the devil, of course, as always with these things, is in the detail. Men remain much more likely to smoke than women, but both have declined since 2015. The highest smoking prevalence continues to be among those aged 25 to 34, and although it's about 10 points lower than it was 10 years ago, it still remains the critical target group for prevention, cessation, and tobacco control. Initiation of smoking, which we've started to measure over the past few years, it very much remains clustered in late adolescence. On average, people have their first cigarette at 16 and transition to daily smoking at around 18, with men reporting slightly earlier than women. The social gradient is also very clear, as it has been throughout the survey series. Smoking is higher among those with a leaving cert or lower levels of education compared to those with higher levels of education. That gap has persisted consistently over the past decade, even as prevalence has fallen across all of these groups. Quitting, of course, remains an opportunity, but it's also a significant challenge. Almost 1 in 3 people are ex-smokers, marginally up from about 28% in 2015. And among current smokers, 46% have attempted to quit in the past year. This is very similar to 2015 and emphasises really the scale of the quitting challenge that many people face. Today, 30% of smokers are trying to quit or actively planning to do so, and with the appetite to stop, and the appetite to stop is very much there. The policy lever, of course, is to make proven supports the easy default choice, especially for young adults and in settings where tobacco use remains normalised. On health outcomes, the gap between those who have smoked and those who have never smoked in self-reported health and reporting long-standing illnesses is very much there and has persisted throughout. Daily smokers are least likely to report good or very good health, and while this gradient is well known, it remains a powerful reminder of the importance of reducing smoking rates. E-cigarette use, stable in very much in headline terms over the period that we've measured it over the past few years, with 8% of the population using e-cigarettes daily or occasionally, and consistently about 3/4 of the population have never tried one. The profile, however, again, as we dig under the headline figure, is where the story is. Among 15 to 24-year-olds, 18% use e-cigarettes daily or occasionally. And within that group, usage has increased among young women over the past year, while it's declined amongst young men. Among daily smokers, e-cigarette use has actually fallen 6 points since 2023, down to 18%, and very much raises questions about the role of e-cigarettes in cessation and the risk of uptake among young people who've never smoked. Among never smokers overall, 3% use e-cigarettes, but this rises to 8% amongst never smokers aged 15 to 24. And again, with that notable gender gap, women 11%, men 4%. For the first time this year, we take a look more detail at e-cigarettes, and we look at device types and flavours. And very much they follow a pattern that we perhaps could have predicted. And very much a difference across the age group. Younger users, much more likely to use disposable devices and fruit flavours. Older users tend more towards refillable devices and tobacco and menthol flavours. And the buying patterns very much reflect the easy retail availability of these devices. Specialist shops to the fore and convenience and forecourt retailers, very much the common sources through which people obtain these. So the policy implications of this are clear. We, of course, need to protect our children and young people from nicotine initiation, including the regulation of e-cigarettes, while also ensuring that adult smokers who choose e-cigarettes as cessation aids get structured, evidence-based support and help them transition off nicotine altogether. This year, we also look at nicotine pouches. Usage remains low overall. We see about 1% in the population overall saying they use nicotine pouches, but we can see the use is very much centred on particular groups. 5% amongst young men aged 15 to 24 currently using nicotine pouches. Very much continued surveillance needed in that area. Moving on to alcohol use. Alcohol, of course, occupies very much a deep cultural space in Ireland and for us all. but the trends over the past decade show a gradually healthier and changing picture. In 2015, we saw that 76% of adults reported drinking in the past 12 months, down to 71% today. Drinking at least weekly, also down, 41 down to 35. And multiple times per week drinking, also down, 24 down to 20. We also see, again, digging under this, we look at age groups, we can see very much notable age shifts. A decade ago, it was those aged 25 to 34 who had the highest past year drinking. We've seen a big decline there, though, and today it's 15 to 24-year-olds who report the highest, while 25 to 34-year-olds are amongst the lowest groups in terms of alcohol consumption. Men, of course, remain more likely than women to drink across all frequencies, and amongst drinkers, men more likely to drink more often than women. Binge drinking, which is on the chart behind me here, binge drinking is defined for the purposes of the survey as consuming 6 or more standard drinks on a typical drinking occasion. This has fallen since 2015. 30%, that grey line there back in 2015, 26% today. But again, we can see the patterns matter. Look at those gender differences. Men, much more likely than women to binge drink, 40% versus 12. Digging in, we introduce age into the equation. We can see men aged 15 to 24, very much the highest binge rate. 51% of men aged 15 to 24 binge drinking. A shift from 2015 when it was men aged 25 to 34, which was the problem. Across the decade, binge rates have very much decreased amongst men and women aged under 45, and most strongly amongst men aged 25 to 34. They've edged up for some of the older male cohorts, and we can also very much see that employment and student status very much correlates with higher binge rates, retirees and those with home duties much more lower. For the first time this year, we dug into a different aspect of this. So we looked at non-alcoholic alternatives, such as 0% beer and wine. 1 in 4 of the population now report drinking these, 25%. We asked people why they're choosing to drink these. So the top reasons, very much practical and health-oriented. Driving home, reducing alcohol consumption for health, and avoiding hangovers. Younger adults and women, very much likely to cite some of those health motives, and men more likely to cite the need to drive home. As availability and quality of no alcohol options improve, the opportunity is very much there to embed them in environments and occasions when heavy drinking has come very much the norm. Menopause, a new section on the survey this year. So for the first time we had a very much in-depth module on menopause to identify and recognise the profound effects it has on daily life, work and well-being. Looking overall across the population, amongst women aged 18 plus, 8% report being in perimenopause, 7% in menopause transition and 28% post-menopause. The peak years very much as you'd expect. 4 in 10 women aged between 45 and 49 report that they're in perimenopause, and over a third of those in their early 50s report being in menopause transition. However, the story is consistent. Significant proportions in all cases are reporting negative experiences, as you can see. Symptoms are very common, but patterns differ by the stage. Perimenopause very much associated with higher prevalence of brain fog, joint pain, headaches, fatigue. The transition phase very much marked by elevated mood symptoms, brain fog and palpitations. We see some improvements in terms of symptom reporting in postmenopause, but many women continuing to experience and report ongoing effects. The frequency and the impact of these symptoms very much vary. 30% of women experiencing menopause symptoms say they are constant, half say they are occasional. Among those with symptoms, 13% report severe impacts on daily life and 33% report moderate impacts, with those in perimenopause more likely to report more moderate impacts. Work and participation very much affected. Among perimenopausal women, 2 out of 5 say they're less able to pay attention in work, at least occasionally. Social participation also suffering. A quarter say they've missed social events, and the same proportion saying they've missed sport, activities or hobbies, at least occasionally due to symptoms. That said, support seeking is active. Among perimenopausal women, 69% say they have sought medical support, and many have consulted multiple information sources, friends, official websites such as the HSE and social media. Medication use very much reflects a symptom burden. 51% in perimenopause have taken medication, and among those with constant symptoms, 81% do so. Of those taking medication, 76% report using HRT, and if we dig down into that group, albeit the numbers get a little bit small, we can see 93% find it very or somewhat effective, but still a strong message. So the message is very clear coming out of the results of this section of the survey. Normalising help seeking, ensuring timely and easy access to evidence-based care, including HRT, and enabling workplace supports can significantly reduce avoidable impacts on women's lives. Moving on then to contraception. So this year's survey, we've looked at contraception in the past, and we returned to it again this year and looked at it in a slightly different way. So it's a dedicated module on contraception within this wave, with a particular focus on the awareness and uptake of the free contraception scheme for women aged 17 to 35. What I found is that awareness of the free contraception scheme is very strong overall and very high among women, and particularly amongst those aged 18 to 24, almost 9 in 10 of whom say that they're at least aware of this scheme. Uptake among eligible women is substantial. Half of women aged 18 to 25 and over a third of women aged 26 to 35 report using the scheme. We asked them for issues that they might have experienced using the scheme, and reported issues are relatively rare. From a policy perspective, what does this tell us? Well, it really shows that it demonstrates that when financial and access barriers are reduced, people will use the services that are made available to them. Maintaining awareness, ensuring method choice, and integrating contraception with broader sexual and reproductive healthcare will certainly sustain and extend these gains. More broadly among contraception, overall 34% of adults say that they or their partner currently use contraception or a method of family planning. And usage, of course, is highest in the 18 to 44 age group, as you'd expect, but methods very much varying by age and life stage, as reported today in the report we're publishing. Moving on then to caring, which tells a very, very strong survey, and it's something we've been trending over the 10 years of the survey, and we look at in a bit more depth in this year's wave, as we've done on some previous reports as well. So again, what we try to do is highlight the invaluable contribution that carers are making. We can see that 14% of the population provide regular, unpaid personal help to a family member or friend with a long-term illness, health problem or disability. Again, we can see that grey line rising pretty consistently over the years that we've done this survey, risen from 9% back in 2015 and shows a gradual upward trajectory since that time. Very strong coming out from this chart as well. You can see that women, of course, more likely than men to play this role. And we can particularly see the highest rates among women aged 45 to 64. And that's a cohort that we kind of look at in a bit more detail in this year's report. Many carers support one person, but nearly 1 in 5 care for multiple people. And almost 1 in 4 carers provide around-the-clock care for someone they live with. And notably, that's a proportion that rises steeply in older age. Despite the time and effort that it takes playing this role, most carers say they can cope most of the time. However, there are still important groups. 21% say they rarely or never get adequate breaks from their caring role, and 11% say they rarely or never cope with their caring role. And very much we can see that those who care for multiple people are less likely to say that they get regular breaks. Throughout the survey, but particularly important with this section, is of course these are not merely figures, they're lived realities. They very much identify opportunities for targeted relief, for respite, for flexible services and support, recognising how care intersects with work, finances and health. This year we also put a particular focus on midlife women carers, a key group, women aged 35 to 54, who we can see from the survey disproportionately carry dual roles of caring for another adult as well as being a parent themselves. 18% of women aged 35 to 54 care for another family member or friend. 12% of the group overall are both a parent to a child aged under 18 as well as being a carer to an adult. Importantly for this group, they are much more likely to be in paid employment. 3/4 of them have a paid job alongside it than carers overall. And their weekly caring hours, while lower than carers overall, still averages at around 30 hours per week. And that's in addition to their work and other family responsibilities that they have. What impact does it have? Well, their self-reported health, good health, is comparable to women of the same age, but the prevalence of long-standing illnesses we can see is slightly higher. Health behaviours are very mixed. Smoking and e-cigarette use, very much similar to women of their same age, but what you can see is that midlife women carers more likely to drink multiple times per week. About a quarter of them say they drink several times a week compared to about 18% of women, other women of their own age. And among those who do drink, we can see 22% binge on the typical drinking occasion compared to 17% of all women of their age. Sleep very much stands out as a pressure point for this group. Only 52% report that they're getting good or very good sleep quality compared to about 2/3 of women of the same age. And very much we can see they sleep fewer hours on average. So again, as it does, in terms of some of the key findings from the menopause section, it very much underscores the importance of designing supports that reflect the realities of managing all this, managing work, managing parenting, and managing care, and how the three intersect. Flexible respite, peer supports, and employer policies all play particular roles in this space. Okay, to wrap it up. So what we see then, a decade of Healthy Ireland data very much shows that some of the persistent evidence-informed policy that's been introduced since the start of this survey very much works. Smoking is down, 23 to 17. Harmful and frequent patterns of alcohol use, down. Those changes haven't happened by accident in society. They reflect everything that's been done: legislation, pricing, availability, enforcement, trusted public information and accessible services, making those healthy choices more achievable. But the data does also show where health is lived, where it's most fragile, and where policy could be more effective. We can see women experiencing menopause, they are seeking help and using medication when appropriate and finding HRT effective. Timely access and clear information remain crucial in this space. Contraception usage is widespread, and we can see from the free contraception scheme, we can see that when cost barriers are removed, uptake is strong and the issues experienced by people are rare. We've also more work to do. For tobacco, we need to continue reducing initiation in adolescence and young adulthood and strengthening some of that cessation support for those who do smoke. Also, of course, ensuring that nicotine products of all types are regulated effectively to protect young people and while supporting adult smokers to quit for good. For alcohol, we need to sustain the gains and sort of reduce frequent use, the reductions in binge drinking, while targeting some of those high-risk edges, particularly young adults, that 18 to 24 age group in particular. And also particularly attention towards we've seen some increase more recently in young women in terms of harmful consumption levels. For some of those newer areas that we've looked at, caring, menopause, contraception, recognising that good policy supports well that those is intended to support. Accessible information, employer and education policies accommodating real lives, real lived experiences and responsive pathways to meet the people where they need it. Methodologically, we continue with the survey. We're in field for the next wave of the survey. So we're looking to, of course, maintain that robust long-term trend. Whereas this year we looked at things like menopause, contraception and caring. Next year we're taking a focus on the survey that's in field at the moment, looking at areas such as diet and nutrition, dental hygiene, sun protection and sunbed usage. Overall, what this tells us emphatically is that progress is possible, and some of those key challenges that when we looked at the start of the survey, when it was initiated back in 2015, we've seen real key progress there, particularly smoking and alcohol. It also tells us where progress has to accelerate, protecting young people from nicotine and harms from alcohol, supporting carers and ensuring menopause care is appropriate, informed, timely and effective, as well, of course, maintaining access and choice in contraception. Of course, the Healthy Ireland survey, whilst there's lots of data, it's not just data. It's all about action. It's how we use that data and how we use the information and findings to inform policy, to shape some of those interventions and empower individuals to make the healthier choices. So the next step is translating some of those insights into improvements in the nation's health. Thank you.
Thank you so much, Kieran, and all your colleagues in Ipsos BNA who've been helping to make this happen over the past 10 years. it's been really brilliant to see all that progress over the last 10 years and to have detailed data describing all of that. So I'd like to take this opportunity to thank everybody, and also to everyone who agreed to be interviewed and so on, for everything that we've achieved with the survey since 2015. I'd also like to say a huge thank you to our colleagues in the CMO division and in the Stats and Analytics division here, plus our Healthy Ireland Survey Advisory Group, and of course to colleagues in the press office who've made all this happen so seamlessly this morning. So many, many thanks to all of you. A quick update to researchers and policymakers looking to access the data. As part of our commitment to publishing open data, we will be updating 40 statistical tables on the CSO's data website, PX Stat I think it is, this morning at 11 o'clock, so have fun. The questionnaire will also be available on our Healthy Ireland Survey documents page. So there'll be an introductory page that has a summary of this year's survey and so on, but also back a bit in the main website, you can get to a documents page which basically has the floor. So many thanks to everyone who submitted some questions. I'm just going to read them out, and we will direct those to Kieran and or the CMO as appropriate. So, first one we have here, disposable vapes, especially fruity flavours, are increasingly popular amongst the young. New taxation did not focus on this. What actions would you advocate taking or are being taken to tackle this problem?
Yeah, this is obviously a concern. So there are, I suppose, a number of ways of that we're approaching it. First of all, funding has been given to the HSE to which has started new information package for particularly parents, guardians and teachers in school. Take a deep breath. You may have heard it already on media, whatever type of media you access. Really empowering, giving parents, teachers, guardians greater in-depth knowledge of how to address the issue of vaping with children and adolescents. I think you probably read my mind when it comes to vaping. There's two bills in advanced draft, one of which is the single-use vape, that there will be a ban on that. That is near completion. And then the second bill, which is an amendment on the nicotine and tobacco and nicotine legislation, is on flavours and colourings. And that's near completion. So, as always, I think that multi-pronged approach to public health intervention is really, really important. And it's something that Minister Murnane O'Connor and Minister Carl McNeill are passionate about, dealing with the issue of vaping. So legislation, education, training of parents, highlighting it as an issue is the approach we're taking. And that will continue.
Thanks very much, Mary. Kieran, I think the next one's for you. Why are there two figures for binge drinking?
There's multiple measurements of harmful and hazardous drinking in the survey because of various different data and information needs. So we have the overall binge drinking measurement, which is drinking 6 or more standard drinks, so 3 pints of beer, on a typical drinking occasion. So that's one measurement there. And then there's also two measurements of the audit scoring for hazardous or harmful drinking, which I think the questioner might be referring to. So we have two measures. We have a shortened scale and the full scale on that. So that's just reflecting various needs in terms of some of the data coming out from the survey. So I'll accept it is complex when you're reading through the data, but I suppose the key thing coming from it is where we can trend it is that they are all trending downwards in terms of binge drinking and also hazardous and harmful drinking, where we have measured that before.
Thanks very much, Kieran. So next one, I think this one's for you as well, Mary. With the stalling in the decline of smoking at 17%, do we need to look at bold policies to prevent and reduce smoking? For example, the smoke-free generation policy being introduced in the Maldives and in the UK.
You know, as I mentioned in my talk, Ireland has always been a leader in tobacco control, and we will continue to do that. The Minister mentioned in her speech the introduction of a banning on sale of tobacco to under 21-year-olds, which will take effect in 2028. We're the first country in the EU that will do that. That's the approach we've taken. There again, it's a multi-pronged approach, giving people access to nicotine replacement therapy, HSE Quit, .ie, another resource, and continue, I suppose, amending the tobacco and alcohol, tobacco and nicotine inhalation product bill, and add to that consistently. We haven't taken the same approach by the UK, but we are looking at what they're doing very closely and see how they're doing on that approach.
Thanks very much, Mary. This one's for Kieran. Is there any insights, or do we have any insights into why we're sleeping less than in 2019?
I don't know. I can only hypothesize on this, but we don't ask people. We ask people to rate the quality of sleep, the amount they sleep. We don't look at some of the factors that might be affecting it, which of course is what's going to inform that. So one could suspect that our lives have perhaps changed quite a lot since 2019. Perhaps lives are getting more stressful in lots of ways, and could be impacting the way in which our quality of sleep and so on. And obviously, the last few years have been full of various stresses within Ireland, external to Ireland as well, and perhaps that's linking through in terms of causing more sleepless nights and reducing sleep quality for cohorts of the population.
Thanks, Kieran. For Mary, are you concerned about menopause stats? 40% of women in perimenopause say that it affects their attention at work, and 27% report missing out on social activities. Free HRT alone may not entirely help this. Are there other solutions?
Yeah, well, I mean, firstly, as a woman, I'm extremely proud that we have put in so much in women's health in the survey. It gives us hugely valuable information. I think, like any condition, it's not just about giving a tablet. It's about educating the woman herself on the symptoms that they may experience, about educating families and friends, and in particular education in the workplace, heightened awareness of menopause and the supports that a woman may require during that period of her life, access to healthcare. GPs, practice nurses are usually the first point of call. I think that's really important, that they can discuss it and feel that they're one of many people who can experience this, and that there are supports there, such as HRT, but also if further intervention is required, to use one of the 6 hubs. But it's never ever just about taking a tablet. It's about a holistic approach to women's health, and an acknowledgement, families and friends, our male work colleagues, that these are real symptoms and that supports are needed within the workplace, so that people can really work in a very healthy environment. So that's what I feel passionate about. But I do really acknowledge the support of Ipsos in adding these questions, and it's the start of, and we'll get more and more information on that and do more and more policy interventions if required.
Thanks, Mary. And just to say that particular menopause module that we're publishing today, those questions were asked and the fieldwork was finished before the launch of the free HRT scheme. So we are very likely to run that module again in a few years to see whether we're actually, no doubt we will see effects from the introduction of further measures as time goes on. Right, next question. For Kieran, are there plans to roll data to provide regional and/or county level data which would allow for greater geographic targeting?
It's possible to do it. That's up to individual researchers if they want to roll together data from multiple waves. Of course, a lot of the questions we ask are consistent across 10 years. We've got some questions there now that have been asked to almost 80,000 people over the years of the study. So it's certainly possible to do that. So you can do that. We've county level data within it. It can be built through the data file. That's available. We're also looking then at some of the health regions then in the current wave of the study. So we're looking at trying to get a bit more granular data to allow us to aggregate to precise health region level of data. So we're asking people, for example, on the current wave to provide their air code so we can identify exactly it is where in the country they live, and we can assign them to the correct place. So that'll give us a lot more power, hopefully, when we're presenting these results next year.
Thanks, Kieran. And another one for you now. While midlife women carers report similar health to the general population, is the same pattern apparent in an older cohort? Are there indications that stress associated with caring roles may have long-term impacts?
I'll preface it by saying I haven't looked specifically at that, but one can only assume. We can see that although carers feel that most of them feel they get adequate respite and breaks, and they feel they can handle their caring roles. We do see that there are cohorts there who are feeling particular strain. One can assume that exists across the population. We also know for older carers is they're more likely to provide around-the-clock care, most likely probably for a spouse, and so undoubtedly that will play out. But it's certainly one worth looking at. We can't look at every angle of the data in the report.
Thanks very much, Kieran. I think this one actually might be for me in that it's a project management one. Will there be any insights into mammograms or breast cancer check in the future HI surveys? Well, just to be clear there, we send around a question to departmental colleagues, and they are free to put that across to the various sections of the HSE and other health agencies that they work with as to what they would like to see in future in future Healthy Ireland surveys. So should the unit involved wish to question people's experiences of breast check or any other, in fact, of the screening services, they'd be more than welcome to submit some proposed questions or modules. So just to say that that's the way that works behind the scenes. Next question. I think this might be one for the CMO. Raising the age of sale of tobacco products aims to solve one problem but doesn't support the high use of nicotine products within the same age group. What needs to be done here to reduce high vape rates? I think we might have already answered some of that.
Yeah, I think I outlined that with upcoming policy changes and bills that will come. And obviously we monitor the impact of those, and a lot of the interventions you may not see it within a year, but as you can see from the data Kieran showed, you can see it over the long term, and I think that's what's important.
Yeah. So this is one for Kieran. How does the survey ensure that underrepresented groups such as ethnic minorities, people with disabilities, or those experiencing socio-economic disadvantage are adequately included?
Well, we use a very rigorous methodology, so I didn't go into the methodological detail because most people aren't interested in it. But yes, what we do is it's a telephone-based survey. So we use that to ensure, arguably telephone surveys give the broadest population coverage currently when it looks to reach into some of those groups in particular. So we have a multi-stage selection process for the survey. So we use a random digit dialing approach of mobile phone numbers. Mobile phones are pretty much universal in Ireland now. So everyone has the opportunity to participate. Most disabilities wouldn't be negatively impacted by that. Obviously, there are some key challenges. Getting people to participate in the survey, for example, who might have hearing issues, might be a challenge, and for whom English isn't their first language is obviously also a challenge. But any methodology we select will face challenges such as those. So we use the best practice method that we can to maximise population coverage. We make multiple calls to phone numbers. We chase down people as much as we can to maximise their chances of taking part. And it's not just, you know, when we look at people being underrepresented in surveys, it's not just, of course, the groups that initially come to mind, but it's also people like young men, for example, younger people, people who have particularly busy lifestyles. They're very difficult to take part in surveys, and they're key groups. If you look at, for example, those midlife women carers, they're spending 30 hours a week caring, they're spending another whatever number of hours working and family life as well. You know, we invest considerable time into making sure, for example, those groups are heard from in particular on the survey as well.
Thank you very much, Kieran. So the next question is, will there be any assessment on the impact of excessive phone use in young people, social media and new AI technologies which may cause addictive behaviour in future survey rounds? So I think I'll take that one because it's a project management piece, but as I said before, for the screening question, should the digital health, people who are looking after digital health policy in the department think that it would be a great idea to add a module on online safety and so on, we would be more than happy to consider it. We send out a request in the spring for the coming year's survey, and then when we have submissions we convene an expert advisory group to look at them and to rank them in terms of order and merit and so on. So basically, absolutely, the survey would be open to considering that and judging it along with all of the other modules that are submitted to us every year. So just, yes, the answer to that. So this is one for, I think, Kieran. Given the hours of care that carers with very heavy caring burdens give, is there a possibility of survey bias in your sample? Our experience of carers is that this cohort never gets respite. 61% seems high.
I don't know what I mean, but bias in terms of accessing these people, like, yeah, I kind of commented on that in the previous answer I gave, is that, yeah, they are a particularly time-pressured group, they are a particularly busy group, their responsibilities are you know, they've quite severe responsibilities in terms of care. So we try as much as we can to make sure their voices are heard in the survey, as we do across all groups in the population. But, you know, it is, you know, there are groups that are perhaps going to be maybe underrepresented. I don't know, we've no measure on it. So particular time pressure groups, you know, is always a challenge.
Thank you very much, Kieran. Could future surveys look into what percentage of self-declared binge drinkers are seeking and receiving help to deal with and reduce or eliminate their alcohol dependency? Again, I think basically with that one, we're reliant on the alcohol experts to submit questions to us. Now, we have a wide range of experts at our disposal in that regard, in that we work with both the Tobacco and Alcohol Control Unit and the Drugs Unit in the department, and also with the HSE Health and Wellbeing Alcohol team. There are a number of interventions out there for people with alcohol dependency. And should those questions be submitted, we can absolutely consider them and think about including them as stated previously. Final question now, and this is one for Kieran. If you combine smoking and the use of e-cigarettes, e-smoking, are more people now smoking than in 2015?
I don't want to answer that question off the top of my head because I haven't added those two numbers together. There is an overlap between the two. We have people, of course, who both smoke and use e-cigarettes or vapes or whatever. So you have obviously that overlap there. So it's not just a simple case of adding the two figures together, but that's certainly something we can run, and I can certainly let the questioner know if they want to talk to us.
Okay, thank you, Kieran, and thank you to everyone who submitted questions. And a huge thank you to all colleagues for supporting this event, and a massive thank you to Kieran and Mary for their presentations, and of course to Minister Murnane O'Connor as well for doing the pre-record. One thing I forgot to mention earlier, for any researchers in the audience who may be looking to access the data from this wave, either through ISDA, the Irish Social Science Data Archive, or through a more detailed individual agreement with the department, with the RMFs. The RMF should be available after Christmas, and ISDA probably by sometime between March and June next year, I think, in line with previous timetables. So just to wrap up by saying thank you all so much for coming this morning. A huge big thank you to everyone who has helped set up this event and has helped to produce the survey, and so on. To all of our partners and stakeholders attending today, Guramila Mahagwif Guler, thank you so much for helping to support our work, share our messages, and help us to implement the policy that then flows from the data. The Healthy Ireland Survey is an incredibly valuable information source for government, for our agencies, for the health system, and of course for researchers, amongst others. Huge thank you also, finally, to everyone who agreed to be interviewed for our survey. Without your information, we would be going nowhere. So your data is helping the health system and helping all of us to provide better services in the years going forward. I'll now bring the formal section of this launch to a close. Please feel free to circulate, chat, and help yourselves to some refreshments. And thanks again to everyone online for tuning in. Goodbye.